Welcome back, and thank you for staying with us. Remember that face? Probably not, because we haven't seen her in a long time. Well,
She's been
that
busy.
was...
She's been busy.
Thank you.
Zuhaira Yusufu, MD, CEO of Aliko Dangote Foundation. Good morning, and thank you for coming.
Good morning. Thank you so much for having me today.
We haven't seen you in a long time, but
That is true. But I
you've
was
been
at your
busy?
studio on the Stock
Abuja.
Exchange
In
a
Abuja.
couple of weeks ago.
Okay.
So I have been around.
Okay.
Yes.
Well, we welcome you to Sunrise
Thank you
once
so
again.
much. Thank you.
When I said we hadn't seen you in a long time, you said you had been busy. There's no doubt about that, because your foundation just recently donated 200 million naira to support the current efforts of the Nigerian government towards curbing the spread of
Coronavirus.
COVID-19.
COVID-19. That's what we all talk about these days, nothing else. So you've pledged 200 million naira.
Yes.
I mean, shed more light on that, please. Tell us more about how that donation came about.
Okay, so the 200 million naira is in relation to a incident action plan that the Nigerian CDC had put together and had submitted to the group of donors of which we're a part of. So that group of donors includes WHO, UNICEF, DFID, USAID, Bill and Melinda Gates Foundation, etc. So they presented this request. This is what they needed to really get the response going. So out of that $1.6 billion request, we pledged $200 million naira. And that 200 million naira is really to support on 3 specific areas, which we felt that we had, let me call it a comparative advantage versus other organizations, given that we've done it before. So that's really around the whole point of entry control. So as people come in, making sure that they are properly screened at the airport. You'll remember during the Ebola crisis, we donated cameras, thermal cameras, to make sure that we were checking people's temperatures as they came through the airport here in Murtala Mohammed. We gave out 12, we installed 12 throughout the international airports, but 6 here in Lagos. So we know that that that's an area that we're not doctors, we're not nurses and practitioners, but we know that there's some things that we have an advantage that we can do, and that was one of those. So things around the point of entry response. So this time we're bringing ambulances, PPE equipment, gels.
Oh, you're not giving the money. It's
some of it will
stuff
be
to the value of.
It will be, some of it will be money, some of it will be things. So if you need ambulances, do we give you the cash to go and sort yourself out getting the ambulances, or can we quickly mobilize an ambulance in a week, and we should be able to deliver these ambulances by Monday? So that's because we are able to do it quicker than going through a, let me call it, government procurement process.
Yeah.
So some of the money we will pay directly, and some of the money we will purchase the equivalent of that money. We'll still spend it. It'll still be worth the 200 million that we pledged.
Okay. You talked about point of entry. You're looking at just the airport. What about the land borders?
So land borders are notoriously challenging. What we've seen so far, though, right, based on the facts of what's been on ground so far hitting us with COVID-19, is that people are coming in with this disease from countries, the UK, Asia,
where it's been
Europe.
prevalent.
Exactly. So those are airport borders, not land borders. So are people from Benin Republic?
No, one of the cases that came in, came in through a land border.
So the reality of life is that we have land borders, we have sea borders, and we have the airports, right? So the reaction, the first reaction always has to go to where the immediate threat is. Trying to have thermal cameras and perfect, absolute screening across every border in Nigeria. I'm not going to say it's impossible, but it's a Herculean task.
Yep.
And what we need to do as the virus is moving is to make sure that we're doing the things that are protecting the biggest threats areas.
Okay, you talked about where areas of priority, where your donations likely to go towards. Is there any plan to, you're not looking at the area of information, sensitizing the people, awareness creation?
Okay, so there's many areas where we could intervene. Isolation centers. Just last night, I was talking to our Lagos Commissioner of Health. We need isolation centers immediately. So that's something that we are looking to help do right away. We need more testing. We will find ways, because I learned it's way more complicated process than laypersons like ourselves understand. Trying to get these testing kits where they need to be, making sure that we have the right people who know how to read the test, making sure that there's a way to isolate people if, God forbid, they're positive. So there's many areas where we could intervene. So that initial ventilators, what do you do with the people who are sick already? How do we make sure we know that about 10% of the population who gets coronavirus will be very ill? What is the plan for those people? So there's many areas where we could intervene. That initial 200 million that we pledged for the NCDC plan was literally looking at what they said was the emergency. This is what we can do now. Every day, the situation evolves. Every day, there's new needs popping up, and so we will be responding
So
as
you're on
we...
standby to,
we
as
are
best
on
as you
standby.
can?
Yes,
Okay,
absolutely.
a contractor, Dangote Fertilizer, was recently suspected to have contracted the COVID-19 before he was tested negative. Now, what measures is the company in itself thinking about checking some of its contractors before they even come in, and how's that working out?
Yes, it's because the protocol worked that we found him, that we immediately took him to Yaba, that he was tested and found negative. It's exactly because we have those protocols in place. If we didn't, who knows what would have happened. So we have protocols in place for the staff, for contractors, travel bans, prevention. We have thermal cameras at the work sites. We have one in our office. We have gel everywhere. We have a COVID response task force that's working every day. So we have a response plan. Well, yes, we have a big company with a lot of employees, and the foundation's playing a small part in, trying to see how we respond to this. But the company as a whole has a plan in place to manage all of this. We have one of the biggest work sites in the country, right? The refinery and fertilizer complex in Lekki. So we have to have measures in place to make sure that we keep our staff safe, our contractors safe, the public safe. So yes, it's exactly the contractor's high temperature that was detected is what triggered the protocol that made us take him to Yaba, get him isolated, get him tested.
Was the protocol in place before this? Or
yes, otherwise, yes.
So it wasn't a question of a situation that's coming, then you start putting...
No, we've been ready since January.
Since January?
Well, of course, the minute we saw that things were coming out of China, do you know how many Chinese contractors and people who are helping us build the refinery? So this was immediately relevant to the group. So this isn't something that we just, by the way, we're hearing COVID, we're seeing it on TV, maybe we should do something. No, we've had a protocol in place since January.
Okay,
made some donation when we had the Ebola crisis. What lessons did you learn from that, which will help you reach your goals, the reasons for you making these donations this time?
The biggest lesson from the Ebola crisis for us was how important it is to collaborate with the federal government, with the state government, with the different donors and partners on ground. The lack of collaboration and cooperation is what delays action and results. What we also learned from the Ebola crisis is that we need to have money available immediately. We have the, let me call it luck, fortune, the way we're set up. The way the foundation is set up is that we have a board that is very responsive, that we have access to immediately. So in terms of procurement processes, in terms of getting approvals to spend money quickly, we have that ability to do. So that's why even during the Ebola crisis, the first actor on the scene with cash to support Lagos State was the Dangote Foundation. And it's going to be, this is what we intend to continue doing going forward. But the biggest lesson is that we have to all work together to, towards eradicating this threat from our environment.
You were also part of the process to free Nigeria from polio. Yeah, lessons from there though.
So it's the exact same lesson. The polio struggle was really around how do we get all the children in Nigeria vaccinated against this disease. And the only way to do that is to collaborate with the people providing the vaccines, the traditional leaders who people listen to and who can debunk rumors, the primary health care center and system where people go to get the injections, all the various donors that are donating workers and cars and trucks and doing polio campaigns. So it's a group effort. And when I say a group effort, not something where you're screaming out, beating your chest to be the one who gets 100% credit for doing everything, but really making sure that the process moves. Recently, someone told me, nobody even knows what you guys did for polio. And I was like, well, did we do it because we want some kind of glory and recognition, or do we want to do this work so that polio is effectively gone from our country? And I think once you understand that ethos and how our boss, Alhaji Aliko, thinks, it's really about let's get these results done. We'll worry about who gets credit afterwards, but let's just get it done.
Okay, then.
Getting it done. What the Northeast? You're spending quite a lot of money in all of these things, and as I noticed that you've not talked about the figures. You're not mentioning figures, but you're part of the Northeast rebuilding process. Why so many? Are you not being stretched thin?
Well, we're not. We are. Everybody's stretched thin because the problems of Nigeria are many, right? So there's a lot to do. There's a lot to do, and all of it needs to be done, right? So in terms of rebuilding in the Northeast, we have built primary health cares in Yobe. They had some that were destroyed. They didn't have, they had like a real gap. So we really built primary health care centers in Yobe. Can we build a primary health care in every part of the Northeast that doesn't have? Of course we can't. We don't have endless resources. We have resources, but we don't have unlimited resources. We need to rebuild. Part of the work that we want to do is also to inspire others to do what we do, right? We can't be the only people doing everything. Dangote, Aliko Dangote Foundation cannot be the only ones who are doing everything. We do what we can, and we strive to encourage and inspire others to do the same. So if we're rebuilding roads, and we've built a village, we're taking over a school, we're doing feeding programs, we want to make sure that we also are demonstrating that Nigerians can come to the rescue,
step forward to help,
right? And that there's things that we can do ourselves, and hopefully others will see what we're doing and be inspired.
When you build the healthcare centers, what about the personnel that will run it? Are you part of that as well?
So now we are actually working with the Primary Health Care Agency of Nigeria to find a more, let me call it, a more strategic way of supporting their efforts of improving the quality of personnel that we have. So we have training centers all over Nigeria that are churning out our nurses and our midwives and our community health workers, et cetera. But we need more of them, and we need better quality people. We need them to learn more and to be able to deliver everything that we need this primary healthcare system to do. So part of our intervention is let's make sure that the Primary Healthcare Development Agency has what it needs to do the job that they're equipped to, that they're meant to do. So yes, we feel stretched. There's a lot to do, but that's, as Alhaji always says, to whom much is given, much is required, and we just have to do what we have to do.
You've got that one right. To whom much is given, much is required. You've been a very busy woman, Zuwaira. Well, all we can say is more grease to your elbows. Zuwaira Yusufu, MD/CEO, Aliko Dangote Foundation.
Thank you very much.
Thank you very much for coming to tell us all about what you've been up to, especially regarding the now famous, or should I say infamous. COVID-19. So we wish you all the best.
Thank you very much. Thank you for having me.
Sunrise will be right back with the home stretch, my partner's favorite part of the program. See you in just a moment.